What's up, everybody? Welcome to NWA Nurses with Attitude. Leanne and I just want to throw a quick shout out to the listeners. Thank you for listening and tuning in to today's episode. Go follow us on Nurses with Attitude on Instagram. Feel free to leave a comment on our post, send us a DM, let us know what you guys think and what you guys want to hear. Enjoy today's episode.
Hello, hello.
Hey,
What's up?
not too much, man. I'm just trying to get my headphones connected.
It's been a while.
Man, I'm so out of practice. Like, I can't get my computer to work. I'm trying to load Facebook so we can get through Messenger and just it's one of those days. It's just not working. But I got it. It's all good. There we go.
I honestly don't even know what we're doing. I'm just like,
Man,
send the
3
link
weeks.
and I'm waiting. Yeah, I don't even recognize your voice.
Oh my gosh. I was like, Joe, when we were doing this regularly, it felt so good, but because we've been out of practice, I'm like, oh, I don't know if I just want to sit and talk right now, But now that we're here, it's
Totally
good. It's
hear
good.
Yo, that's straight up like working out. If you stay on like a steady workout regimen, it's like, man, easy peasy lemon squeezy. But you miss a week or you get like sick, so you fall off, and you just never go back. Like it's hard. It's hard to go back. But we're here.
We're here. We're back
And
at it.
let's get it.
I want to apologize in advance, guys. My chair is a little squeaky. So if you hear that, that's what that is.
Hey, Leanna, how's your cat doing?
She's good. She's she's a part of the family,
Yeah, did she do good with your dad? Like,
Oh yeah,
did your
yeah,
dad use
everything's
good?
good. She's a short-haired cat, so she doesn't really shed that much. And I vacuumed and stuff to make sure that there wasn't as much hair and stuff. But yeah, no, it was good. And um, no crazy allergic reactions or anything. I'm still not 100% a cat person, but we love her and she's a part of the family. She's kind of like the sibling that you can't choose, you know what I mean?
Yeah, totally hear you.
It's like she chose us and we don't have a choice. Like she's just fucking stuck here now,
Yeah.
Yeah, but she's good. She cuddles. She's sweet. All is good.
Oh, that's awesome.
Yeah.
When
How's up north
I
this
got up
time?
to, man, it's great. It's just great.
Yeah.
I'm in an apartment. Usually I'd be by myself, but just because of the way things worked out, I have a roommate in this apartment, but it's a big apartment. It's almost like it's an apartment, but it's the same size as the house I was in last time. Um,
Dang.
and it's like a whole, so I'm actually on top of the health center where we are. Like that's where we live. So in the mornings, I
Oh,
start work at 8:30. I literally I leave the house. It's literally my office is right below where I sleep.
man,
So
that's
it's
awesome.
freaking, oh, it's so awesome. And I was gonna say that there's a cat who lives in this apartment complex. It's in an apartment next door,
Okay.
and they leave everyone just leaves their doors open and whatever, I guess. So the cat will come out in the hallway, and they told me, they were like, Joe, there's a cat. And I'm like, game, I love cats. I'm gonna pet the shit out of this kitty.
Yeah.
Um what they didn't tell me, that this cat is a fucking monster. This
What do
cat's
you
like a dog.
mean? Oh, he's
So
huge.
it's like this, not only, yeah, he's huge, he's humongous, okay, but he has opposable thumbs like humans.
No. Okay, this is a thing.
I s-
I've seen this
this
before.
is a thing. Have you?
Yeah.
I was
Yes.
like, what's wrong with his paws? Like they're hands. I'm like, what the hell? And he was walking towards me. I'm like, holy shit, what do I do? And
That's
his
so
eyes are
funny.
wide open. Oh yeah, but he's so cute. His name's Oscar.
Is he
He still
friendly?
scares me. He's super, super friendly, but he's in his own little world. He's not like a cuddly cat.
Okay.
He kind of he'll walk around and he'll kind of and he wants you to follow him everywhere. But no, super, super cool cat. Just it terrified me because the first time I met him, I walked out of the washroom and he was like sneaking up on me, and I
Yeah.
saw something in the corner of my eye, and I'm like, is that like a mini lion? Like, what is this? Um, and it was the cat, and apparently he can grab things. Like
Whose
if you
cat
put a
is it?
pencil, it's my manager's cat.
So, okay, so you guys all stay in this apartment building and that's where the cat is? Like it just like roams around the building?
Yeah, well, not really an apartment building, but it's the health center. So this is the
Okay, yeah.
community health center, and
Yeah,
then
yeah.
upstairs is like the residence for like the staff. So there's like 3 apartments here
Oh, I see. Okay.
upstairs. Yeah,
So the cat
and it's
just
just
like
like a long
chills.
hallway. Exactly, yeah. There's like a workout
Dang.
room, laundry room. He just kind of like walks around and stuff.
So are you allowed to bring your kitty next time?
It depends because so this is like the manager, so like she kind of
Right.
like runs this place.
Yeah.
So it depends. Like some places, most places don't allow pets, I hear.
Yeah, yeah.
Um,
Which
and
makes
it depends
sense.
on like who you're living with. It
I'm
does, yeah, because
just kind of like curious. That's kind of crazy. Like I get she's the manager and like calls the shots, I guess, but like you'd never see that anywhere else, man. That's exciting that you have like a little fur baby with you.
oh my God, it's so amazing. And like I was about to fall asleep the other night. It was like 11 o'clock, and I heard him like meowing.
Yeah.
Man, Leanne, I jumped out of the bed. I'm like, I'm coming, buddy. I'm coming. Like running down the hallway.
Aw. Honestly, if they had like a house dog or a cat, cats are good because they don't take as much attention. It's good for like your mental health. Like you don't feel alone, you don't feel so secluded. Like even me as a not really a cat person, I'd be excited to have like a cat around if I was doing travel nursing. You know, but I don't have allergies and I get that
Yes.
people do, but I can see like how the cat can bring maybe just a little bit of joy to someone's life like that, you know? Like, listen to you. You're so
Yeah.
excited about this dang cat.
Oh yeah, like oh for sure. I personally think they should do that everywhere. Like if you do travel nursing, just have like that hangs out. And cats can live on. Like just give the bad
Yeah.
boy like a cat litter. Like he's good.
Yeah. Yeah, exactly. Dang, man. Well,
Yeah,
I'm
but
happy
that's
to
how it's
hear
been
that
going.
everything's good. Like,
Yeah. Oh, thanks. Yeah, it's awesome. I have like 1 more week left. Then I'm going home for Christmas.
exciting.
Yeah. And how's everything with Leanne? Still doing the
All is
same
good.
thing?
Same thing, different day, man. We started our basement, so we're now on to painting and, switching out lights and, just kind of trying to make the space more ours. So that's kind of what we've been working on last weekend and then this weekend again throughout the week. But yeah, man, just like random house shit. Different shit, different day, Same shit, different
Right
day.
on. Are you just-
Different
are
shit, different
you
day.
Hey, that's pretty much like a lot of the population that we deal with. It's different shit, different day. Like one day it's diarrhea, one day it's constipation.
Oh man, I miss patient care so much. Oh god.
Oh man. So I have a question, Leanne. Is
Ah.
it the same color scheme you're using that you explained to me before? It was like this, it was like a gray with a red.
Gray with red?
Yeah, didn't you say there was a color scheme you're using and it was like a gray with a red?
No. Where do you get red
So what's the
from?
color scheme?
For the
I think
basement?
yeah, yeah, what's the color scheme for the basement?
Like grayish green for like the stairs, and then the back wall is gonna be like a dark forest green.
So
Dude,
there's
we
no
don't do
red.
red. There's no red. Leanne does not like
Okay,
red.
but so is there no red in your house whatsoever?
No. We did like very
Okay, I
much
don't know
like
why I
cool
thought.
tone grays. Our like our bathroom on the main floor, like off of our kind of entry kitchen to living room, is dark navy blue. Our kitchen's green, but we haven't painted that. It just came that way. My office is
Hmm.
pink. No red, man. We're
Your
doing our
office is
bedroom
pink.
purple. Yeah, the back wall, but it's not like pink. It's like a mauve. It's not bad, okay? And I don't like pink.
No idea what mauve.
Mauve is
Mauve. It's a
the
mauve
most
color.
the most male comment you're gonna make this whole podcast. I don't know what mauve is.
Man, like you stick with the core colors, okay?
So
Like
funny. Okay,
core
so it's
colors only.
pink. It's a pink, kind of like a beigey pink.
A beigey or a bougie? Is it
Beige.
bougie pink?
Oh gosh. I
Mauve
can see
is now going to be called bougie pink.
we're off to a great start today with this podcast.
But
Oh
I think both
man.
of us just came into this like freaking like twiddling our thumbs and stuff.
Yeah, we're so out of practice. But Joe, what are we talking about today? Do we even have a topic? Or are we winging this
I
one? What
think
do you want to do?
I think there is a topic because this has been a topic that you mentioned from the beginning that I would like to touch because I know it's very close to you. And it's nurse abuse.
Oh man, you're gonna make my blood pressure go through the roof.
I
Okay,
think
so
it's a really important topic to talk about and discuss because there's so many different avenues that we
yeah,
could go down, and there's a lot of different perspectives. And you posted a few different perspectives as well,
yeah.
and I thought it was pretty cool. So I don't know. I'd just like to talk about it.
Yeah, let's do it. Before we get into it, guys, don't forget to follow our podcast on Spotify, share it with your friends. We also have an Instagram, Nurses with Attitude. Follow us there. Yeah, so Joe, there's this photo that I come across that I've shared every year on Facebook. It shows up in my memories and I see it and it just like lights a fire in me, okay? So, I will share the photo on our Instagram so people like have an idea of what we're talking about. But if you are in the nursing community, you've definitely seen this photo. Essentially, it's a photo of a protester, and I would make the assumption that she's a nurse, and she's holding a sign, and the sign says, "You punch a cop, arrested. A bus driver, arrested. A bartender, arrested. A nurse, what could you have done differently? Management." And this just makes me so mad because I can't even explain to you, Joe, how many times when I worked on the floor, management said those exact words to me. Well, how did you approach the patient? What was your interaction with them? What could we do differently next time? Now, when I posted this on my Instagram, I did get some messages on like people saying they didn't understand or whatever. And I think that, there's obviously this, people are ignorant to this because they've never been in it or, generally most people are very thankful when you're in the hospital for whatever reason, you never really like, anybody in my life that I know would never be rude to someone, in hospital or whatever. Maybe that's because they know I'm a nurse, but I don't know. Either way.
Like, were people messaging you asking you if like they were confused with, they just didn't think that this happened, like they didn't think people would like
Yeah.
want to punch nurses? Okay.
Yeah. And then also the debate kind of came up that, people who have dementia or mental deficits, how can this apply to them when they don't control their actions? And I want to know your thoughts on that, Joe. So, dementia comes with it's a whole like realm of nursing in itself. And, it comes with specific training and all of these things that we use to manage dementia. And I'm just wondering, do you feel that the abuse applies when people have dementia? Like, what are your thoughts on this? What do you think maybe separates it? Give me your thoughts.
I think there's a clear distinction between the two kinds of patients. Those like, so dementia would fall under like they can't control, not even that they can't control their actions, but specifically to the comment like what you could have done differently. Unfortunately, I agree with that comment to an extent because I have seen in my practice where some people go into people's rooms and they have dementia and they like, and I know you've seen this too, Leanne. They run in there, they flip the lights on. Okay, we're getting up, and they yank their pants off.
Mm-hmm.
If I have dementia and like I have no idea what you're doing, I'd probably sock you too.
Yeah.
Do I think that that's an approach? Like if you came to me and you got punched, and the very first thing I said to you was, "Oh, what do you think?" Like that's inappropriate. Obviously, you need to look at the needs of your employees, right? You need to say, "Hey,
Mm-hmm.
are you okay? Do you?" Regardless of how you got there, if you did something wrong, you still got punched in the face. That could be very scary. You could be
Mm-hmm.
hurt. Let's sit down and take care of you as a person and not just discount everything by saying what you could have done differently. I think that that can be used in a later stage by saying, hey, maybe next time we do care, um, let's approach him this way, because reality is we're not going to arrest a man with dementia.
No.
That said, I know this comment is also used in hospitals and in like acute settings where someone's just upset and like someone gets drunk, comes into the
Mm-hmm.
ER, abuses a
Mm-hmm.
nurse. My opinion, you should be charged because you're
Yeah.
responsible for your actions. I don't care if you're drunk or not.
Yeah.
If you come into the ER and you abuse someone, you're like abusing someone, right? And
Right.
I think there's situations where in those acute settings they're just not taken seriously because it's, oh well, you signed up for this. Well,
Right.
police officers, they sign up for their job, and if someone touches them with their pinky, they're getting tased and arrested.
Yeah.
So like that's
Exactly.
kind of the difference. Does that make sense?
Yeah, absolutely. I agree, Joe. I think that when you work in long-term care and you have residents that have dementia, these people and they're very responsive in their actions. I don't like to say um abusive or what's the typical word that people use?
Like
Aggressive.
aggressive.
Yeah.
Yeah.
I don't like to use aggressive. I like to use responsive because they're trying to communicate to you. It's in response to a stimuli. So when you have a resident that comes in and, you know, they move in, they have their care plans made, the residents that are more responsive than others. You have the residents that wander, you have the residents that, are always trying to pack for their cruise that's leaving Tuesday morning, exit seekers. And then you have those residents that don't like personal care and they like to throw fists and spit and, pull hair and scratch and all that. That's I'm excluding that from this statement. So I agree with you, Joe. I think that there's, um I'm like having a hard time finding my words here to like I want to be I don't want to be misunderstood. Um
Mm-hmm.
I think that, in that situation, staff have specific training. So whether that's like gentle persuasive approach training, that's very common. I don't know if that's still offered, but I know that when we were in school and at the long-term care home I worked at, we were all trained in that. And when we were dealing with residents like this, you know, staff the staffs that would go in would be comfortable with that resident. And if they weren't comfortable dealing with that or didn't have the proper training, then they would swap or whatever, or ask for assistance or, two at a time or whatever. There's ways around it. Um so I think it's important to mention that I agree with you, Joe. Like I think that, managing people with dementia and who have responsive symptoms is very difficult. And it takes a team to do that. And so I think that I don't think this sign is intended towards that specific population.
Mm-hmm.
When I see this sign, I interpret it as like the nurse working in the ER and they have the drunk people that come in or whoever. They don't even need to be under the influence. People are just fucking assholes regardless.
Yep.
Like, have you ever I know that you've worked in different settings more than I have. I come from very much a long-term care background and then now in community, but do you have any like personal experiences with abuse, or like, I don't know, any stories you heard from other nurses that you want to share?
All of my personal stories have been with like people who have dementia or like other cognitive
Mhm.
disabilities. I have heard stories of um triage nurses actually, and people just being like getting aggressive and like, you know, punching them in the face. And
Yeah.
you know, I've actually known some nurses that press charges, and you would be surprised, like they get a lot of kickback. Like, are you really sure you want
Yeah.
to press charges? Like, is that like, are you sure? Like, look at the context of it. And it's like the context of it is that this person came
Mhm.
to access this government funded service. They were upset about something, so they decided to use physical force on me. Like,
Right.
in
Yeah.
what context is that okay? And like,
Right.
you know, we have individual rights um to like press charges. I'm not saying like, you know, if someone listening, like if someone attacks you, to press charges. But what I will say is that we need to start holding people accountable for their actions. This isn't like
Yeah.
a you should get away scot free, because who's going to be next after that?
Right.
That might be like a very extreme approach, but no, I've never had anyone be aggressive to me. And I think like I'm a 6'3", like 220 pure solid muscle.
Mhm.
So
Well, okay. To be fair. Like, you didn't think I
just
would
for
catch
those
that.
of you who are listening, if you don't know what I look like, I often get, you know, confused with Dwayne the Rock Johnson. So just I'm just a little more pale.
Oh my god.
But no,
Oh, too good.
people I've never been like physically attacked or anything. I've been verbally attacked
Oh,
many
yeah,
times, but no,
given, like, on a
nothing
daily
physical.
basis. It's interesting,
Oh,
Joe,
it's
because
just
yeah, but it's sad that that's just, like, we take that. Like, to say, like, "Oh, it's a given that I just get called a fucking asshole at work," or get screamed at, and, like, our residents like, "Fuck you, get out of my room," or blah, 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 like, we just, like, brush it off like another day at the office, you know?
yeah, I remember my first time
Um,
getting yelled at, and I was like,
ugh,
my blood pressure rose, and I was like, "Oh my gosh!" And like today, I literally got screamed at, and I was just like, "Okay, bye. Like,
see you
I'll see you
later.
next week." You know?
It's different when people have dementia because they're not under control of their cognitive, uh, abilities, I guess. It's just it does it make the job any easier knowing they have dementia? Not really, to be honest. Like, Joe, it hurts the soul
It
when you
makes you
have
empathize
someone
more, but
that's like, "Fuck you, fuck you, fuck you, fuck you," and you're like, "Ma'am, like, I'm just trying to clean your bum. Like, I'm trying to help
mhm.
you," you know? And it's yeah, it still weighs on the
I
soul.
had
It does.
I had one lady tell me that the wrath of God is gonna smite me down, and I was like, "Holy shit." I was
No,
like,
that's
and honestly,
aggressive.
like that, right? I took a step back. I was like, "Whoa!" Like we need to debrief about this, because that's not okay. Like the wrath of God is gonna
Dang.
smite you down. I was like, "Holy shit!" She does not like me.
You know what?
Um,
And that's okay, but, like, you're there to just provide them support in whatever way that you can, you know? Ugh, Joe, my
yeah,
thing is,
and
like
we're all trained to handle this. Like the thing is, we're all
yeah,
trained, and you know, you handle it in a professional manner.
yeah,
And but like what you're saying is it's still hard. You come home from work
yes,
and you're like emotionally drained, because you have to use the front part of your brain, you know, your frontal cortex, to logically think about like what's happening, and you have to work through it, and you have to use a lot of strategies
mhm,
um to be able to go through your day with a smile, with a like, "Hey, I'm here to help you and care for you," and then deliver that. And
mhm,
you come home and you're completely drained. It's and
yeah,
I don't think a lot of people see that part of nursing. You know, they might see some
yeah,
nurses, you know, went to the hospital and like we had such great service. The nurses were so amazing. But then we're human too, guys. Like we come home and you know, like you don't see that part of it, right? Like you don't see when we come
Yeah.
home and then we do struggle with these things. So
Yeah, for sure. I want to mention, Joe, that I want to talk about like sexual abuse too, because I think this is huge. And I don't know if you've ever experienced this as a male, but for me, let me fucking tell you, working in long term care on a unit of like 80% men who don't all have dementia, I'd like to preface that. Not all of my residents had dementia. Many of them were of sound mind, and they would say things like, "Oh, look at her ass," or if I turned someone on their side towards me and helping the healthcare aide on the other side of the bed, they would like reach around and grab my ass. And like men who would, wheel by in their little wheelchairs, they'd poke you in the butt on the way by. And like, that's not okay. In
no.
school, we I don't know if this was in nursing school or health or when I was in school to be a support worker, Joe, but um, let me know if you remember this at all. I think it might have been with healthcare aides. We were talking about providing pericare, and like as a female, you need to be aware that sometimes you don't always have men that are super old, let's say, and an erection happens. And they talked about just kind of moving on to something else and coming back to it, or just like not making a big deal about it, or just kind of talking through, or not. You don't want to draw attention, because oftentimes these things are out of our control and it's just like a natural thing that happens. But like, wait, Joe, do you remember that in school, or was that with support worker?
Oh yeah.
Cool.
I know I do. It was
Yeah.
like a question on a test, I think too, yeah.
Yeah, like what do you
Like what do
do
you
if
do if you're like caring for
yeah.
someone and they get an erection?
Yeah.
Yep.
Okay, so it was nursing school. I'm pretty sure they would have touched on that in personal support worker school too, but anyhow,
No
this
pun
this
intended.
like this happened all the time for me. And it's really fucking awkward. And I understand it's out of people's control, but like, okay, being touched in the ass, or like, you know, the two little old men that like to play cards and talk about the staff, and like, that don't have dementia would like say rude things or sexual things, or like, oh, ugh. Like I don't even know how to explain it, but it just it would weigh on me. And, I would brush it off at the time, but then certain residents, like at a point, Joe, I started to get really upset about this, and because it would happen constantly. And I remember like turning around to one resident and just being like, that's not appropriate. Like, we're done here, And not
Good
often
for
would
you.
I ever like raise my voice like that towards a resident or anything, but like, I deserve respect. I respect you. You need to respect me, you know? And I guess it's just tough because we're in people's personal spaces. We're literally caring for them like people haven't cared for them in a long time. Like a lot, I talk about men specifically because that's what I dealt with. But I know damn well, Joe, that there's little old ladies out there that are on the prowl. Like, I know that exists. Just like,
Oh yeah. If
have you
I was
ever
80
had?
years younger,
Yeah, yeah. Like,
if I had a dime every time I heard that.
right? Oh, but I think
Yeah.
that
Oh yeah, like I don't like it's definitely happened. Like I've been like sexualized for
yeah,
sure.
yeah,
Not to like the same extent though. Like I don't think like, if I ever have to do like care on a female, there was nothing like ever like that. For me, I feel like
yeah,
it was honestly like more harmless. Like I had like, one resident and she was actually a lot of fun. she would come down and she would look at me and like she would like God, she would like bite her lips at me and she'd be like, "Boy, you get over here right now. We're going dancing." And she would get
Aw,
up and like she would start dancing. And like
yeah,
sometimes I would walk over and like like dance next to her and stuff, but it was
yeah,
completely friendly. Like it wasn't
right,
so it's more comments like that and you get the occasional like, "Oh, if this was 80 years ago, like, oh boy." Um, but I've
yeah,
seen because a majority of nursing is women. I've seen
yeah,
what you're talking about, and it's not okay. And I used to tell my staff, and I used to tell the residents who were cognitive, like the residents who could
yeah,
understand, that there's no place for that here. That we're here to help you, and it's a huge disrespect whenever you sexualize the people who are just trying to help you, right?
right,
That's not okay because you're making them feel uncomfortable, and it's not
mhm,
acceptable here. Like we're gonna
absolutely,
have to make something work, and
yeah,
um as a male, I would always, if we did have residents who have sexual behaviors, we would mark them down. And I would go in for 5 minutes and do their pericare.
yeah,
I remember one day I walked in and they were about to do this one man's pericare and his hands were like behind his head and he
oh
was like
god,
getting ready and like he like purposely like spread his legs out wide
yeah.
and like he was getting ready. Then I walked in and I'm like, "Hey," and he's like, "Oh," I'm like, "Yep," like I'm washing you today,
Surprise!
you know, right?
We would do
Like,
that too. We
yeah.
would have a male, like, swap out if it got to the point where, like, staff were uncomfortable, and, again, obviously, people with dementia, they don't have the capacity to understand what's right and wrong, and, legally, they would be deemed as, um, like, unfit in terms of, like, cognitive capacity. But I think it's important to bring this side of things up, Joe, because when we talk about nurse abuse, like everybody is aware of the screaming and the fuck yous and the all this, but I don't think a lot of people realize like the sexualizing that we deal with. And, I definitely see this more as a female, but even in hospital, like I would bet my whole life savings that this still happens in hospital, not even with like elderly people, just people who are really high on meds or just lonely people, honestly.
Mm-hmm.
And
Mm-hmm.
I just think it's important to mention.
100%. People, especially in like home care is where you get a lot of like those, people are like lonely, right?
Yeah. Yeah.
Um, and you come in and as nurses doing home care, like you're part of the community, and sometimes um things can get like misconstrued, and that's why it's also important as a nurse to always practice a professional relationship, right? And
Yeah.
you have to be very careful of the signs that you might be giving off that you don't even realize you're giving off. So you have to really understand like that dynamic there. Um, and another
And
part of home care too is like people need to realize um when you go into someone's home, like you don't know what you're gonna get. So like when I
right.
did home care, like they do extensive training on like picking up signs that like some shit's gonna go down. And there's been situations for me that I had to like leave. I picked up my shit and got the fuck out because some stuff was happening and it's like something's gonna happen, got out, call the
Yeah.
cops, like,
Yeah. Yeah. It's sketchy.
like it's a risk that you take whenever you
Yeah.
go in there.
It is. Yeah. Yeah, I haven't come across that yet in community, but again, I'm not doing the one-to-one, like I'm not providing the care. But I did want to talk about an experience I had um actually last week, Joe. Um story time with Leanne. I was bringing a client to hospital. She was being admitted and obviously I can't say much more than that, but I was bringing her to the hospital and she was being admitted. She had a bed ready. The unit was expecting her. So, I picked her up. We drove her to the hospital, brought her up to the unit. And when I got to the nursing desk, I was like, "Hi, I have so and so. She's being admitted. Can you point me in the direction of her room?" And the nurse said, yep, sure, no problem. She's at the end on the left. So an RN like met up with me. We walked down the hall. We got her into her bed. And directly across from where my client was, there was a man. And Joe, I wasn't even in this hospital for more than 7 minutes. Okay. And this guy was screaming at the nurses. Fuck you. I want my fucking medication now. It's due in half an hour. You're fucking gonna give it to me, you piece of shit. I want it now. I don't care what the fucking doctor said. Just going off, okay? Like, this man was losing it. And there were 2 nurses with him, and we were getting my client ready into bed and whatever, and I'm just kind of listening out, I mean, he's screaming. He's not quiet by any means. And there's 2 nurses with him, and they are like, I'm really sorry, sir, but your meds are not due yet. I'm very sorry. I can ask the doctor if there's anything we can give you, like, in the interim. Like, I'm very sorry. I'm so sorry. I'm so sorry. And this is like all you heard. And Joe, my heart sank. Like, when I left the hospital, and I wasn't there for more than 7 minutes, literally, I dropped my client off, I got her into bed, and I walked away. I gave the nurse like a little mini report, and then I walked away. That's it. 7 minutes. And I left the hospital so heavy-hearted for those nurses. Joe, as someone who has stepped away from bedside nursing, like, listen, 2 years ago, if that was me, I would have been like, okay, sir, get your ass into bed. Like, screw you, Like, obviously I wouldn't say that, but like, I'm just trying to say that I would have more of a backbone, and this
Yeah.
kind of thing wouldn't bother me. But when I saw that nurse walk away, her shoulders were slumped, and you could tell that she was like having the worst fucking day. And I can only make the assumption that it was due to this asshole. So, Joe, when I left that hospital, I was almost in tears. Like, it was like I was looking in a mirror and seeing myself at one point giving care, and like seeing it from an outside perspective for the first time. And like, when you've been out of something for a while, like, you don't really realize. So because this had happened to me like almost every day during my like 2 years of working on the floor, it was like nothing. It was like, you put up this like hardness, and you get this like shell, and you like build this backbone, and that's all like fine and dandy, but you're not actually dealing with it. Like, when people are verbally abusive to you, it weighs on you, and it weighs on you, and it weighs on you. And like, I can't even explain it. Like, Joe, I was literally almost in tears at like just the fact that people treat people like that. And he's bitching about his medication, and
Yeah.
I can almost bet, I would say 75% here, that this man did not have dementia. Like, he seemed pretty cognitively intact. Obviously, I don't know his background, but given the unit and everything, could say with certainty that he did not have dementia. And I just like,
And you know
wow.
what? Like, people, just to clarify, like, most people with dementia do not have
Right.
those actual like behaviors. Like, most of the time, like a good portion of the time, I would say, like, it's people who are cognitively well aware, and like,
Yes.
I get it. Like, you're at the hospital, something happened, like, you're stressed, it's been a shitty week, but at the same time, that's not acceptable at all.
Yeah. And yeah, Joe, it just left me so heavy-hearted. Like, I called Ben, and I was like, babe, like, I don't even know if I can continue my RN. Like, I was just like, it just hit me. And obviously I'm still going through with my RN and going to pursue other things, but like, I so miss bedside nursing, but I don't miss those parts of bedside nursing. And so this was also like after seeing that post and then seeing this literally within the like 7 minutes I was at the hospital, like I was just like, we need to talk about this. Like, holy fuck. It's a lot. I just it just sent me through this like I started questioning on whether I should continue my education because I don't feel that I should be treated that way. Basically. You know?
Yeah.
It's like we
And
just accept it.
it's tough. Yeah, it's tough when you like it's almost like a um epidemic, is that the right word to use? Like within nursing. Um
Yeah, yeah.
but there's no solution to it right now because of that post that you posted. Like there's just this whole culture of that we should just take it, and like that poor nurse, like I'm so sorry, sir. Like I'm on the same boat as you, Leanne. Like I'm not sorry. Like let's
Right?
work together and figure something out for you, but you're not getting this medication until I'm legally allowed to give it to you.
Right.
So if you want to get mad and everything, you can get mad, and you can get mad in your room with the door closed because there's other people on this unit as well.
Yeah. And that's the thing
You
is
know,
like
like
Joe, I think a lot of the abuse comes from not having the knowledge surrounding our parameters as a nurse. So meaning like you say you can only give a certain medication, an hour before, an hour after, certain medications 15-minute window, certain medications like there's all these stipulations. And you know, I would assume that in the hospital, from my experience from placements, like there's not a doctor on the unit 24/7. You usually go to the RN that's on duty, and then as an LPN, you would report to the RN, and then the RN can like report to the doctor, and you may get an answer within the hour, you may not. Like it's not a quick turnaround, so the nurses, they
and we're
just
in a huge
try.
doctor shortage too.
Right.
Like and a huge nursing shortage. Like the whole chain of command, like that just makes it a lot longer because you have
Exactly.
300 people all going to the doctor at the same time because they want a PRN. And
Right.
it sucks. Tough
Yeah.
situation.
A PRN, for anyone listening, is a medication given as needed. Um, Oh, Joe, but I can't like this whole situation of like dropping my client off just totally took it out of me. And I just want people to know, I guess, that like nurse abuse is not okay. And I think we need to obviously educate our patients, provide
Yeah.
the education, but you don't have to be sorry. There's She didn't do anything wrong. I would make the assumption, he was bitching about medication and whatever. But just like apologizing and apologizing doesn't get you anywhere.
Hmm.
Just it's okay to set healthy boundaries. You don't need to be rude about it, but we're people too,
Yeah.
you know? And oh, yeah, I don't know. I'm so happy that I don't have to deal with this at this moment, but like I don't get me wrong, Joe, like it's not necessarily abuse per se, but I have like families that are harassing me like every day. It's just like a different kind of abuse, you know?
Yeah. It's like
Oh
not being
man.
considerate. There's no
Oh,
consideration in a lot of it. And it's like you said 5 minutes ago, they just don't understand. Like whenever
right.
whenever like you're a family member, or like even if you're calling your doctor's office, like there's only certain things that we have in our control,
Yeah.
and you just unfortunately you need to let it like play out its course. At the same time, to saying that, I think it's also important for nurses to show compassion, to show empathy,
Yeah.
because in this environment it's super easy to kind of take an outlook of like, it's screw everyone. I'm gonna do A, B, and C, and anyone who gets in my way, like just screw them. And I do know
Yeah.
nurses like that. And like I on one hand I understand. On the other hand, I completely disagree, and like that's not acceptable. It's like the saying, two wrongs don't make a right.
Yeah.
We need to provide education to future nurses, current nurses, and nurses who've been in the profession for a long time, of how we can handle these stresses and how we can, you know, communicate with people in an effective way. Because I'll be honest, sitting there and saying, I'm so sorry, like, oh my gosh, like, let's that's not effective.
No, it's
In
not.
whatever world it is, it's not effective.
No.
Looking at that guy and saying, "Oh, well, fuck you, man," like, did it that's not effective either.
No.
Like, don't do
No,
that.
it's not.
But there's a good middle ground of,
Mhm.
um, being able to provide care and being assertive,
Yes.
that it can switch the situation around, and a lot of people confuse assertiveness with being like, "You're gonna listen to me, da 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 da." That's not what assertiveness is,
No.
right? And it looks different in every situation, but it's you have a need to be respected and a need for, like, caring for people, and, in
Mhm.
that situation, it's just, "Listen, man, I'm legally not required to give you this medication. Let's work something out, or you can go to the room and you can wait for the 30 minutes because you're
Right.
upsetting everyone on the unit." And,
Mhm.
whatever that might look like, not
Yeah.
verbatim or anything, but yeah, it's just we need that education. It's a huge gap in practice.
I think, Joe, something important to mention too is like we've kind of got on this topic of like managing the abuse. And I think a lot of nurses, and I'm talking specifically more about, when patients complain about medication, which I would say is probably 70% of the complaints that they make. Their pain medication, they're in pain, or, whatever the case is. Use your non medical, your non, um, oh, what's the word? Your non medication interventions. So, Joe, if this was me, and this was one of my patients in the hospital, and he's complaining that he's in pain and he wants his medication and he doesn't give a fuck that it's 30 minutes too early and blah, blah, blah. I would say, why don't you lay down? We'll reposition you. I'll get you a warm blanket. We can put a warm heating pad on your back or wherever the pain is, whatever, usually the back, whatever. And I will go talk to the RN. And if there's anything else I can do within the next half an hour, I will come back. If not, I will be back here in half an hour with your medication. You have to set boundaries. And I think a good way of doing that, Joe, is saying, I will be back in 10 minutes. I will be back in half an hour. I will be back in 5 minutes. And if you say that time, you got to come back. But it I found it to be really successful. Is like, use ice, use heat, use repositioning, use distraction, turn on the TV, play music, have them
Yeah.
call their wife, like other things, just distraction. Like we all know that the heat, the warm blanket ain't gonna do shit. Okay, but it takes their mind off it for like half an hour, you know?
Mm-hmm.
Um, so I think that by leveraging these like non-medical interventions or, you know, outside of medication, there's other things we can do, And I think that's a good way
Yeah.
to help manage too.
100%. I think you hit it on the nail. Like, we need to be resourceful
Yeah.
and more than just medication, because that's how people get reliant on medication, and we need to teach people
Mhm.
that. I have a little story. Now it's story time with Joe, but it just reminded me when you're like, we need to use different measures
Yeah.
to help people with pain. And when I was working at the hospital, I was working at this hospital, and there was two sides of the unit. So I was on one side, and I had my partner, and she was on the other side. And she was a relatively new nurse, and she had gotten, the education, I guess, that, like, we all kind of get, but, like, people get addicted to, like, hydromorphone, and, like, people seek it and this and that, right? So I was on this unit for like a while, and I was on the side that she was on for a bit, and then I switched over to the other side. So I pretty much knew everyone on that unit.
Mhm.
And this was a night shift, and it's like 11:30, and just finished all of like our treatments and stuff and everything. And I hear this guy in pain, and I'm like, "Hey," like, he keeps like ringing his call bell, like, "Did you go see him?" And she to me how he's addicted to hydromorphone. And I'm like, first of all, someone's addicted to hydromorphone. because that's like kind
Mhm.
of like a diagnosis. So like I had no idea
Yeah.
where she was coming from. So I said like let's look at like the facts. So look at the Mar. He is on hydromorphone, but he's also on another medication. Oh, it's like the Robax Platinums. Like he's on like that medication, metho something, like not
Yeah.
meth, but like methocarbamol or like something like that. And it's
Yeah.
a muscle relaxant. So maybe he's having pain. But on the medication record, Leanne, this is like middle of the month. He hasn't gotten this pain medication once. And I was on, like I said, I was on that side the month before. We switched every month. And I didn't actually give him the hydromorphone, but I gave him the muscle relaxant because I remember he had neck pain. So I was like, well, like, what's your assessment of, you think he's addicted to hydromorphone? She's like, oh, well, he's asking for painkillers. And he's asking for painkillers and he's addicted to them. And I
Oh.
said, well, here's another like wild fucking guess. Maybe he's just in pain. Have you thought about that? Like,
Yeah,
so
seriously.
I walked over to him, Leanne, and I was like, hey, like how's it going? And this man, he was in his late 60s, crying in his bed, Leanne, crying for his
Oh.
mom. And he was completely like, that's how much you touched him. He was full of sweat. He was suffering. And I
Oh.
looked at his neck and I could see the muscle fibers spasming in his neck. And
Oh.
I was appalled. And I honestly, I grabbed her because we had our own like narcotic carts, but man, I took the
Yeah.
keys from her. I gave him hydromorphine myself, and she was like, well, like you need to like tell the manager. I'm like, oh, I am telling the manager. I'm telling the manager that like you're essentially like making this man suffer. So
Yeah.
sure enough, the next day, and like, man, I report people for that. Like, I'm not like, I know some nurses are very against like reporting each other, but I'm under the very strict like rule of, if I tell you something and you don't want to like listen and you don't want to like even communicate about it, but you're so stuck in your ways, then,
Yeah.
and if I think it's going to be a harm to someone, like I will tell a nurse straight to their face, hey, you need to change this. And she wasn't, this lady wasn't, she was stuck in her own pattern of told the manager, and I told the doctor, and the doctor kicked her off the unit actually. And because you can't do that, like the
No.
doctors are ordering this medication. If he was begging for hydromorphone and he wasn't having, like, it's just it's such a tricky slope, and it breaks my heart to see that
Well,
there's nurses like that.
the thing is, Joe, is that typically, so for people listening, to explain this a little bit more in depth, when people are put on stronger pain medication like hydromorphone, typically a doctor prescribes it as a PRN medication to start. So this would be an as needed basis. At least this is what the doctors that I've always worked with do. And what they do is over a week or 2 week basis, they see how often it's been given. And so if they find that a resident is using the hydromorphone for pain every 4 hours, and they've previously been on Tylenol and Advil, and to be honest, like everybody is on Tylenol and it don't do shit, then that's how they make the order. So doctors aren't just going to come in and be like, oh yeah, here's 2 milligrams of hydromorphone, blah, blah, blah. Like, no, like there's a reason why the orders are in
It's not
place.
candy.
Right.
Exactly.
And exactly. And, you know, there's like this nurse's obviously assessment was not great. If I'm
Oh,
being
this, yeah,
kind.
she was fresh from school. There was so many things that like, and hey, like
This comes with
we need
time
to,
though.
it does come with time, and we need to
Yeah.
teach each other. The
Yeah.
problem is that like, if you don't want to be teached, like if you don't want to be taught,
Yeah.
because it was like she came in also with an attitude of like, I just came out of school, I know absolutely everything, and it was like,
Yeah.
okay, but now you
Right.
have someone suffering because of your lack of knowledge,
Yeah,
and
exactly.
that's a big problem, you know.
Yeah. And yeah, I mean I've seen it too, Joe, and like people are afraid to give the PRN. And I'm like, but that's what it's there for. Like just document. Like what's
Oh,
the problem?
oh man, have you ever had people, and I don't know why, but people are so scared to give Ventolin. Have you ever had a situation like that, Leanne?
No,
Like
why?
like you I don't know what it is. Everywhere I go, like, okay, this person's coughing and like they're barely breathing and they have a PRN for Ventolin. I'm like, yeah, but I didn't want to give it. It's like
Why?
I it's just it's a common medication that I've seen not been being given for like issues. And um I like I actually, funny enough, at the same hospital there was an issue with someone kept calling the doctor for this person because they kept like their O2 stats they kept going under like 89, and this
Yeah.
person had a Ventolin, and the nurses just kept calling the doctor, and the doctor was like, "That's why we have the Ventolin. The Ventolin is the answer to that call from like 3 weeks ago, but
Yeah,
no
yeah, yeah.
one's using the Ventolin." So the
Right.
first thing the doctor's gonna ask you, what PRNs have you given this person
Exactly.
that I prescribed? And they're like, well,
Right.
nothing. And the
And this
doctor's
is
gonna say,
where
okay,
right, and this is where they build their orders. So PRNs are in place for a reason. This is what I was saying. Like the PRN order is there for Ventolin. Fucking use it.
yeah. And I'm not saying don't give this person Ventolin every 5 minutes. Like, follow the orders.
Yeah,
Like,
of
be
course,
safe
of
and use
course.
your like critical judgment. Like,
Of
don't
course.
hand out the whole bottle of hydromorphone to someone because you see an order for it. Like, follow the
Right.
orders,
Yeah, of
but
course.
be very very critical. And it's learning. We need to help each other. Like,
Mhm.
just to say too, like, I've made so many mistakes as a nurse, and I've been in this situation where I did something that was based off my lack of knowledge. Unfortunately, I have colleagues saying, hey, like, don't be an idiot, and like, take it and like learn and grow from it, right?
Yeah. Well, I
um
mean, we've all
because
made mistakes,
like,
Joe. Like nobody's perfect.
exactly, right. And we've only been nurses for like a few years, so I just
Yeah.
want people to know that, like, we do not know everything.
Yeah,
Just
for
I'm just
sure.
gonna throw that out there right now. I make a lot of mistakes,
Yeah,
but
but we also don't
it's a
deserve to
learning
be screamed
practice.
at.
We also don't deserve, exactly, right? Like, it's
Yeah. I don't know. I didn't really have a chance to do any more like research or look further into like nurse abuse and what kind of bills there are, or if there's anything that like protects nurses or that kind of thing. I'm very uneducated when it comes to this kind of thing, but I just thought it was important to bring up and chat about and talk about our experiences and you know we literally nurse on the opposite ends of the fucking country, Joe, and like we still experience this. Like it's not one place, it's all of them. It doesn't matter where you work. You could
hmm
be at a doctor's office, at a clinic, and people are still rude to you.
yeah.
Like
Oh, it's everywhere.
it's just important to bring awareness and maybe some tips on how to manage. And I think we did hit a couple of those in this episode. Um, but yeah, Joe, is there anything else you want to end on? Anything else you want to chat about today? It's good to be back.
It's so good. Honestly, I think another big thing to realize too is that nurses can get charged. Like, if
Yeah.
someone, let's say, if someone just came and attacked me and I pushed that person away from me, so like it's a full defense, nurses will be charged. Like,
Yeah.
if you touch someone, because um of our role, we're put in a power, or we're put in a position of power. So if
Mhm.
we push someone and they say, hey, this nurse pushed me, I want to charge them, they can charge you. So you're almost in a very very tricky situation, that in those aggressive situations or dangerous situations, you have to solely rely on
Your training,
your, like,
your knowledge.
your training. Exactly.
Yeah. Which is interesting you bring this up because like cops do this all the time. And there was this whole thing, I don't really want to get into it, but the Black Lives Matter movement and all that, and there were all these like, cops abusing and very obvious abuse that they would do to
Yeah.
someone who's African American versus a Caucasian, and that's like totally not acceptable in any stretch of the imagination. But does anybody ever like sue these cops? Not that I hear of. Like maybe, but maybe the like bigger circumstances, but day to day, like if you're just trying to protect yourself as a nurse and someone's coming at you and then they can sue you after. Like, it's fucked up.
Yeah,
Fucked up. We need
but
more
you
protection.
literally have cops who are like, someone raises their finger and they feel threatened, so they tase them and like throw them on the ground, and
Yeah.
like it's just, and like they do that because they know nothing's gonna happen. Like
They're in
they know that
authority.
they have the power
Yeah.
to actually do that, right? And yeah,
It's
that's just
fucked up.
wild.
I don't agree with it.
Another thing too is the way that I think that we feel about it, and like we feel about abuse. If you go ask a McDonald's drive-through person,
Yo, I can't
like
believe you
they would
brought this
probably
up.
feel that they would probably feel the exact same way.
Okay, Joe, I worked at McDonald's. This is no secret. I was in the drive-thru and somebody screamed at me and I started to cry. Literally. This was like I was 20 years old. Man, I'm not kidding. People are awful. And I just sat there
People
and
like
cried. I closed the window and the guy was giving me the finger through the window and I just stood there and cried. Like, what a douchebag.
how fucking pathetic can you be?
Like,
I'm
I'm just
sorry.
a wee baby. Like, leave me alone, man. I'm just trying to take your order for your fucking Big Mac. Like,
Like, this is a public service announcement to people who you're having a bad day, you go through the McDonald's drive-through. I want you to realize that you're yelling and abusing teenagers and like younger adults
oh,
because of
something that
like a
happened in your
fast
life.
food.
Yeah.
Like how high of standards you have of McDonald's employees in the first place.
It's
Like
like, it's displacement. So, like, I learned this in psychology. You know, the one thing that I learned in this fucking course, Joe, is that it's it's a way of coping. It's like a coping mechanism, and people displace their feelings. So they like, let's say you're mad at Jelena and you guys get into a fight. And then what you do is like when you go through the McDonald's drive-through, you're screaming at the fucking attendee in the drive-through, but really you're pissed off because Jelena pissed you off. You know what I mean? It's called displacement. It's we see it all the time.
I could just see someone yelling at you in like the McDonald's drive-through, and at the end of it they're like, I hate you, mom.
Honestly, now if that was me, I would have been like, go fuck yourself. Have a great day. And I would have just closed the window, But I was just a small little baby, I didn't
Right.
like
Aw.
just trying to like work my job and make $14 an hour and like pay my bills. Like, man, just give me your money and move to the next window.
Right? Oh, you're at the first window and they're already giving you shit.
Yeah, man. Oh,
Move
God.
along.
Ugh.
When I worked at McDonald's when Tim Hortons changed their coffee, and then they also like rose all their prices.
Yeah.
And I remember working that morning that they did this. I'm never gonna forget that morning. I worked right next to a Tim Hortons. So we got all the people coming in, and I don't know how they noticed. Like Tim Hortons raised their price like 10 cents, and people were livid. They were not having it. And I don't know why. Maybe someone in the audience listening or something can give me an answer. Why the fuck would you come to me at McDonald's and yell at me for Tim Hortons raising their prices?
Yeah, I
Like they
know.
were straight up yelling at me, like the fuck is wrong with you? A lot of things are wrong with me, but none of them have to do with Tim Hortons raising their prices. You know?
Joe, listen, it's a good skill to be self-aware, okay? Oh man,
I'm
all
like,
jokes
fuck, like
aside.
easy question.
All jokes aside, I'm really happy you brought that whole drive-through thing up because I think that's something that a lot of people can relate to. A lot of people that listen may have worked in like the service industry or worked at a department store or a grocery store or even McDonald's, Tim Hortons, like all these like just regular jobs, And when we talk about nurse abuse and people screaming at us and whatever, like this doesn't just happen in nursing. And I think it's tough in nursing because you're like genuinely trying to help people get better is kind of the idea, or, help them with their daily activities and sort of, help them navigate life. So like the sweater at the department store isn't really important, but I think it's important to mention that because a lot of people can relate to that. And I think a lot of people
Mhm.
have had these types of interactions. And if we're all just fucking nicer to each other, the world would be a lot better place.
Amen.
Yeah. I want to end
Amen.
on that.
I think that's a
Listen,
great note to end on.
the last episode, Leanne was fiery. She had some really strong opinions. This one too, a little fiery. Okay, we're coming out of our shell a little bit. People who like know me that know that this is like the real me. Like the first couple
Mhm.
episodes, I was very like reserved. You know, I still have to watch what I say. I work in a management position. I need to be professional, but it's okay to share our opinions, talk about them online, talk about things that we deal with in nursing. Like this is important,
Yes.
you know. Joe, what do you want to end on?
I think you said it beautifully, and we just need to love each other, guys. If you get pissed, like if something happens to you and it upsets you, remember how that makes you feel. So whenever
Yeah,
you're in the opposite position, you can empathize with someone
yeah, exactly.
instead of just being bitter, you know? So
For
yeah, yo, guys,
sure.
thanks for listening. We didn't post an episode on the Monday that just passed, but we're back.
We're back.
Yes. All right,
Thanks
guys.
for listening,
Peace.
guys. Bye.